Hi, my name is Dr. John Schnorr. I'm one of the founding partners of Coastal Fertility Specialists, and I'm excited to be here with you today. I wanted to talk with you about a very common set of tests that we do for couples with infertility called ovarian reserve testing. In infertility, we think ovarian reserve means that it's a discussion of the number of eggs in your ovaries and the quality of eggs in your ovaries. So those are really two completely separate things, egg number and egg quality. The best measure of egg quality is actually female age. The younger you are, the better the egg quality is. And actually tends to be that the younger you are, the more eggs that are in the ovary. It turns out that as a woman ages, egg quality tends to go down and egg number tends to go down. And that's because when women are born, they're born with all the eggs they're ever going to have in their body. Typically at birth, there's about 1 million eggs in each ovary, and that number gradually declines. What we do know is that not all women at the same age have the same number of eggs, that there are things in your body that can lower egg number in your body. Things that can lower egg number commonly would be genetic abnormalities, that you could be born with a lower number of eggs. We know that chemotherapy and radiation therapy can lower egg numbers. We know that endometriosis is associated with lower egg numbers. We know tobacco use is associated with lower egg numbers. Ovarian surgery can hurt the ovaries and lower egg numbers in your ovary. And for your reproductive endocrinologist, knowing egg number and knowing egg quality becomes important for helping to figure out what course of treatment is best for you, how much medications to help you make eggs, how many eggs you'll likely make, and what the overall pregnancy rates would be. Now, there are a variety of ways to measure ovarian reserve. Probably one of the simplest measures, as I mentioned, is female age, that the younger you are, the more eggs there are, and the better the quality. We know that women above 40 years of age, we have concerns about egg number and egg quality. Second way, we actually take a look during ultrasound. During a new patient visit, you'll generally have an ultrasound where we can count the number of maturing eggs in your ovaries. It's interesting that at that time your ovaries might have about a total of 250,000 eggs in each ovary, but about 8 eggs in each ovary start to mature. Your body matures those in just the right way, so 1 egg ovulates out of your body per month. What we can see on ultrasound during your new patient visit or any ultrasounds is the number of maturing eggs. Again, normal's around 8. If you have more than 8 maturing eggs in your ovaries, that would be a reassuring sign to let us know that egg number looks good. If you have lower than the 8 number of maturing eggs in your ovaries, that would suggest that there's a lower total number of eggs in your ovaries. So that's one measure. The second measure is called Antimullerian hormone, also known as AMH. That can be measured at any time of your menstrual cycle. A normal level depends on the female age, but around 35 years of age, normal is about 2.5 for an antimullerian hormone. Higher levels are better. That means there's more eggs, and lower levels would suggest a lower number of eggs. And so antimullerian hormone becomes a good, accurate test. If you have 100 women in the room with low egg number, about 80 out of the 100 will have an abnormal ultrasound. About 80 out of 100 will have an abnormal antimullerian hormone level. That gives us what we call a sensitivity of about 80%, which we think is pretty good. Now, the last test you probably heard a lot about is FSH levels. FSH levels are the hormones that your brain makes to help make eggs. Turns out that if egg number is lower in your body compensates by making more FSH, and that higher FSH helps your body make eggs better. FSH levels are generally normal if they're less than 8 to 9. If they're above 9, those are thought to be elevated FSH levels. Doesn't mean you can't get pregnant if you have an elevated FSH levels. It just means that the higher your FSH level is, the lower the chance of pregnancy is, mostly from an egg number and egg quality standpoint. We tend to find through multiple studies that your chance of having a baby through any form of infertility treatment is significantly diminished once its FSH is greater than 14 or so, and studies show that a level above 17 or 18 would result in a very low chance of pregnancy with infertility treatment. So we'll keep our fingers crossed and hope that's not it. If you have any questions about ovarian reserve testing, please feel free to let us know. This is going to be the end of this video. Your nurses will be around if you have any questions to call, or also feel free to give me a call and we can talk more about ovarian reserve testing. Hope you have a great week. Bye-bye.